So before starting the wound care, I just want to do some hand hygiene. Okay, perfect. 15 to 20 seconds. And I'm going to introduce myself to the patient. So, hi, my name is Michaela. I'm going to be doing your wound dressing today. Is that okay? Okay, perfect. And can I just take a look at your ID badge? And can you just tell me your name and date of birth, please? Okay, perfect. Everything matches. I'm just going to give you a lower angle so you could see everything better. Perfect. So everything is at waist level. I'm going to start by putting on my clean gloves and removing the old dressing and discarding of that. And then I'm going to measure the wound for the length, the depth, and the width. And to measure that, I'm just going to be using our measuring tool here. And then I'm going to discard of this. I'm going to remove my gloves and discard of those as well. And I can chart the findings. And now I can open the wound care kit. This is going to be our garbage. I cut a piece of tape for us already. I'm just going to put that here for us. Perfect. So we have a nice place to put our garbage. I'm also just going to put the blue pad here. And I could put a K basin here as well in case, so there's no leaking on the patient or on the bed or any of the sheets or whatever. I'm going to be doing hand hygiene again. And then I'm going to be opening the dressing tray. So we always want to open away from us, only touching the 1-inch border. Perfect. And we have our trusty tweezers. We're going to be squaring it off. Perfect. I'm going to be putting it here again in the 1-inch border. Pick it back up. And this is for addition, like if we want another sterile field, we can always put that. Put that down. And then we're going to add everything into our sterile field. So first, I'm going to add the syringe. Okay. Discard that. Put that back down. Get our blunt needle. We always want to use the banana peel method. Putting that in there, putting that down, discarding that. And then we can put our normal saline, and this is the new bottle, so we don't have to lip it. Boom, 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 boom. Make sure it's closed tightly. And then we're going to grab our ribbon gauze, open this up, and we can put it in the saline solution. Put that back. And then we're going to get our pad here. And put this here in the one. There you go. And then we're going to discard of this again. Okay. Now that we have everything added to our sterile field, I'm going to don my sterile gloves. Okay, can discard of that. Actually, before I put my sterile gloves on, I'm actually just going to remove the packing, the ribbon gauze from the wound, just so I don't have to use the other tweezers, and so I don't use these while in my sterile procedure. Okay, I'm just going to get rid of that. Done. I'm going to do hand hygiene again. It's hiding on me. Perfect. Okay, now I'm ready to don my sterile gloves. Okay, so I'm going to grab it here. I'm going to, without touching, we always want to put our thumb first because the rest of the fingers will eventually follow. And we don't want to play with that too much just in case we touch our sterile gloves. And then we can grab them like so, like this. And perfect. Okay, so now that my gloves are on, we're going to grab our syringe and the normal saline fluid, and we're going to add our blunt needle. Perfect. We're just going to take that cap off, put that there in our sterile field, and then we're going to irrigate the wound in a zigzag motion. Perfect. Now I'm going to just put the cap back on for safety measures. But I'm just going to keep that in our sterile field. And then I'm going to dry the wound with these 2x2 gauze. So I'm going to clean one side of the wound, discard of that. Then I'm going to clean the other side. Perfect. And then finally the last side. And then discard. And then we're going to put the ribbon gauze around, wrap that around. Okay, and now we're just going to pack it, but not too tightly. Perfect, fits right in the wound. Okay, we're gonna put these back, and then I'm going to grab my 4x4, cover the wound, and then finally our pad and cover the wound. Okay, so now we're done our sterile procedure. I can take this, I will take the needle and dispose of it in the sharps. And I can take off my gloves, so hold that. Okay, not touching. Discard again. And then I'm just going to get the tape. And secure it on the wound. Probably about 2 pieces. Okay. That is everything.